I fried my finger. That's what can happen. Pain is always a personal experience, especially neuropathic pain. Some people say it tingles. Some people say it burns. And some people say, I feel a prick. It is what you feel. Pain and its perception are different phenomena. Pain is just electric signal goes through the nerves. What you describe is very, very personal. And another thing which is not good actually, pain is described as sensory and emotional experience. But traditionally, it was researched separately from emotion. So you have pain, deal with that, whatever emotions you have. How do we sense pain? Nerve cells or neurons called nociceptors throughout the body. You have them outside, inside your organs, react to nauseous signal, painful signal. Electrical impulse travels from those nociceptors to your spine and to the brain. If the situation around your head, around your face, then the spine is not involved. The signal goes directly to, to the brain. Pain accompanies inflammation. Again, inflammation is an adaptive mechanism. With some conditions, though, you cannot identify inflammation. Speaking about fibromyalgia, the inflammation is in the brain. So C-reactive protein, erythrocyte sedimentation rate, plasma viscosity, they don't show it. So pain may be also accompanied, but not necessarily, by swelling and heat. When you have swelling, it may press the nociceptors, and that's how electrical signal travels. With heat, well, you feel heat. There may be nothing, but you feel heat. Inflammation, which we are talking about, has an adaptive role in the sense that it is immune system, is different system from nervous system, responds to the danger, such as pathogens, damaged cells, toxic compounds, radiation. It acts to, by attempting to remove the injurious entity, such as splint under your skin, from your body and initiate healing process. It's a defense mechanism, but it is believed that nerves themselves also can be inflamed, and then it's no good. Another thing about pain, I personally would like to have it, but there is no one silver bullet, magic pill, magic food that can kill the pain. Types of pain. Pain can be classified by the duration and mechanism. By duration, acute pain is short in duration. It may last from minutes to 3-6 months. Acute pain tends to be related to soft tissue injury or a temporary illness. It subsides when injury or illness are healed. Acute pain from an injury may evolve into the chronic pain if injury doesn't heal correctly, or if in your brain pain signal malfunction. Chronic pain is longer in duration. So if you go to the doctor and say, I have chronic pain, the answer is, do you have it more than 6 months? No, I have it for a week. Go home. Come in 6 months. It can be also intermittent. It can come and go. For example, headaches, migraines. You may have them your whole life, so it's classified as chronic, though they come and they go and they come again. Chronic pain usually is related to the chronic condition like arthritis, fibromyalgia, spine condition, but it may be debilitating and linked to disability. There is another type of pain which takes episodes of acute pain, chronic pain, which are taking medication. So some pain breaks through the medication action and then side that then breaks through. But mechanism. It's due to the damage to the nerves or other parts of nervous system. It's often described as stabbing, or burning pain. It feels like pins and needles. It also can affect sensitivity to touch and can make someone difficult to feel cold or hot. I don't feel hot myself. Neuropathic pain is common type of chronic pain. It may be intermittent, can come and go, and can be so severe that people cannot perform everyday tasks because the pain can interfere with normal movement, also can lead to mobility issues. Central pain. Central pain is neuropathic pain in the central nervous system. It can occur following stroke or multiple sclerosis. It is seen in various chronic rheumatological and musculoskeletal disorders. As opposed to peripheral neuropathy, result of the damage to nerve located outside of the brain and spinal cord. It causes weakness, numbness, usually in hands and feet. It can also affect other areas in the body functions, including digestion, urination, and circulation, till damage to the nervous system. Nociceptive pain. It is caused by the damage to the body tissue. People often describe it as being sharp, achy, and throbbing. It is often caused by external injury. For example, if you hit your elbow, stub your toe, twist your ankle like this, hurts. Do surgery, fall and scrape your knee. This is nociceptive pain experience. This type of experience in joints, muscles, skin, tendons, bones. It also can be acute and chronic. Somatic pain originates from pain receptors on the surface of the body and in musculoskeletal tissue. Patients with cancer and bone metastasis have it, as opposed to pain from pain receptors located in internal organs within the cavity of the body. Another type of pain is radicular pain, and unfortunately, if you live a little bit your life, you're gonna experience it. It's known sciatica, when pain from the spine radiates to your leg, and you may lose feeling in the leg. It's called radiculopathy or sciatica. Sciatic nerve in this situation is affected. This pain is always steady, and people have it for a long time. Plastic pain. It's a term for the doctor to say I don't know what causes your pain. The origin is unknown. There are many situations when they say, I don't know, you just have pain. And mixed pain is complex overlap of all types of pain we were talking about. Now, very interesting to know if you have to see the doctor. Well, question, if I stub my toe, should I go to the doctor? If I hit my elbow? Probably no. But if something happened, say car accident, and 6 months in the road you still feel it, you probably have to see the doctor. So the rule of thumb, if it lasts longer than you expect, you have to see the doctor. Or it's so severe, it interferes with your daily life, please go see the doctor right away. Pain by the numbers. Okay. High impact pain is a chronic pain that results in substantial restriction to daily activities. The numbers in Western world pretty much the same between 2016 and 2022. About 20% of US adults, which is more than 50 million, precisely 51.6 million, experience chronic pain. The numbers are the same in Canada, with the largest numbers not in Ontario for some reason, but in Atlantic provinces, 21.7%. And from these numbers, about 7%, 6.9% in the US, which is 17 million people, experience high impact chronic pain, which means their daily activities, their life, their well-being are highly affected by the pain. The most painful conditions, I just made it fun. I don't know how fun it is. Yes, pain is not fun. It's the wrong word. By the numbers. According to CDC, the most painful condition, or the most painful is neuropathic pain. Here are some numbers. And if you, at some point in your life, experience pain, you know you are not alone. This is while very, wait. Yes, this is very widespread problem. Which numbers are most interesting? Lower back, I think. Sciatica, 55 million in North America, including discogenic component, which involves degeneration of the discus. Rheumatoid arthritis affects 2.5 million North Americans. Osteoarthritis, which is not curable, 16 million. Multiple sclerosis, about 1 million. So there's a lot of people who suffer. The question is why they suffer. Maybe because they are not using holistic methods. Neuropathic pain. So if CDC thinks it's the worst, let's look a little bit. First of all, it's peculiar because everybody describes it different. Like you have pricks and I have tingles. You have burning and I have ache. And it's still neuropathic pain. Scientists don't know why, but the hypothesis is conflict between the body and sensory system. The signal is the same. The brain processes it differently. Why? Nobody knows. Often, there is no possibility to determine what causes neuropathic pain. Yes, there are situations we know, but there are situations we don't know. And in those situations, painkillers didn't work. They don't. No painkillers, no anti-inflammatory. You just face your pain one-on-one. By the way, I'm not trying to show off. If you think those pictures are strange, I generated them using artificial intelligence. Listen to me and look at the pictures. This is original art. I don't know if how much art, but I think they're fun. Shana, it shows something else. Oh, oh. And here I was to ask the artificial intelligence and to show me how dense is the pain. And this picture came out. I decided, okay, that to illustrate that it is unclear how it is arising. Most common causes are, first of all, diabetes. Diabetes causes increased glucose in the blood vessels. overdose. From my experience, I tried opioids for chronic pain, and it was extremely difficult to come off. Like, it was extremely difficult. And if you like Dr. House, it's Vicodin victim, right? He pretty much ruined his life with painkillers. Medicines can be prescribed in the form of patches, creams, gels, and those magic gels you can buy in the pharmacy or in the health store. They usually contain painkillers: lidocaine, menthol, arnica, capsaicin, ground turmeric. You can use it in the form of pouches. Um, they can help if the pain is limited to one spot. Like you twist your ankle, you use turmeric pouches, you walk like this for a whole day, and then it's gone. Yay, at least something. Drug injections are done with botulinum toxin, novocaine, steroids, and local painkillers. Again, this is not a treatment. If they say you will be pain-free, no, it's wrong. It may alleviate pain for up to 6 months and then it comes back. Diet plays a huge role. As a nutritionist, I will discuss like whole second part of the lecture is devoted to nutrition. And also there are modern supplements that can help fighting pain. I am dietary supplement some consultant, and that's why I have license to talk about supplements. They cannot resolve everything, but they can help big time. Next topic. Fibromyalgia. Everybody heard, nobody understands, right? Me neither. It's a mysterious, difficult to diagnose disease affecting 2-3% of population in westernized world. That comes to 900,000 in Canada and about 4 million people in USA, with in the USA with approximately 80 to 90% of the sufferers women. Fibromyalgia is a chronic disorder that causes pain and tenderness throughout the body. The pain is accompanied by a range of other symptoms, including poor sleep, fatigue, depression. The pain is present. This is a key. The pain is present in tender areas. You cannot say, or it hurts here, because it hurts here and there, and you cannot pinpoint the point. There are no trigger points. Like, for example, here, there is something which bothers me, and it has a node underneath. No, then it is not fibromyalgia. It is very interesting that fibromyalgia is officially recognized as a combination of psychological and physical disorders, and its treatment includes medications, plural, affecting psychological state, such as selective serotonin reuptake inhibitors, or SSRIs. Another thing about fibromyalgia, it's diagnosed by exclusion. So the doctor, depending on the experience and points of view, should exclude all other potential problems to give a diagnosis. And thus, there is a high frequency of misdiagnosis. For example, musculoskeletal disorders, hyperparathyroidism, hypothyroidism, depression, to name a few, can give this pain sensation all over the body. And then it's misdiagnosed. And if the trigger points, even if you have like 1,000 trigger points on your body, but you know precisely each and every point, and there is a hard node underneath, it's not fibromyalgia. Well, I had this discussion with two of my doctors. One agreed, another slapped me. She has fibromyalgia. She doesn't want to take a treatment. But this is beyond the point, right? So if you have nodes, it's not fibromyalgia. Full stop. Misdiagnosis is also attributed to the fact that there is no lab findings. We were talking about inflammatory markers in the blood with many pain conditions, none in fibromyalgia, because inflammation is generally in the brain. There is only one thing called substance P, substance pain, which is found to be increased in the blood of a person with fibromyalgia. Substance P is a neuropeptide made of 11 amino acids. This is complex chemical which has several physiological functions. For example, in cancer, in diabetes, in rheumatoid arthritis, myocarditis, heart failure, epilepsy, migraine, thrombosis, depression, anxiety, and fibromyalgia. There is no cure for fibromyalgia, but healthcare providers can help manage and treat the symptoms. So if everybody agrees, not just one doctor slaps the label, several doctors, the team has to agree this is fibromyalgia, then the symptoms can be helped too. Treatment typically involves combination of exercise, other movement therapy, psychological and behavioral therapy, medications, and anything that can close pain gate. We will be talking about it a little bit later. Another interesting topic is, are there any neurotransmitters involved in pain? And the answer is yes. Disbalance of neurotransmitters such as epinephrine, serotonin, and dopamine in the brain is responsible for both development of chronic pain and mental health problems because of the same shared anatomy, meaning the same areas in the brain responsible for pain perception, depression, anxiety, and even the same receptors are responsible for this. Homeostasis, in health sciences, homeostasis is the balance. We'll be using this word sometimes. Homeostasis of those neurotransmitters is very important. If your body decides and can inhibit pain signals, then you have homeostasis. If your body decides it will increase pain signals beyond what they are, then you have a problem, and this problem needs to be addressed. So about the functions. From those neurotransmitters, only norepinephrine or epinephrine is inhibitory to pain. Serotonin may inhibit pain or it can increase pain. And the most interesting is dopamine. Dopamine controls the importance of pain stimuli. Let me explain a little bit. Dopamine regular is important for thinking, memory, movement, and reward. It also plays a role in maintenance of chronic pain. Inhibition of the pain pathways is somehow rewarding. So if the neurotransmitter is for reward, then inhibition is rewarding. The theory is that dopamine modulates the importance of pain stimuli and thus mediate motivation to avoid or endure pain, depending on situational context. Number of studies had shown that dopamine homeostasis in the central nervous system, brain, and spinal cord is disrupted by painful stimuli. That's how transition from acute to chronic pain can occur. In other words, too much dopamine, too low dopamine, you are primed to develop chronic pain. Targeting dopamine-containing cells permanently reversed chronic pain in mice, so far in mice. The scientists found the group of dopamine-containing cells in the mice brain, a back part of hypothalamus, and the cell is called A11, and that reduced chronic pain in mice permanently. So no dopamine, no pain. It has been reported that dopamine receptors D1, D5 in mice spine also engage the mechanism of spinal hypersensitivity. Recent human studies. There are studies on humans, but thank God they don't remove the cells from our brains yet for having pain. The studies were about dopamine precursors, tyrosine and phenylalanine. And those studies showed that depletion of dopamine appears not to increase the actual perception of pain, but unpleasantness, feeling of the pain of being unpleasant, having emotional reaction to the pain. Okay, so there are some magic foods which you probably can eat to address your pain. Tyrosine is found in soy products, chicken, turkey, fish, peanuts, almonds, avocados, bananas, milk, cheese, yogurt, lima beans, pumpkin seeds, sesame seeds, so lots of stuff. And also foods like veggies, fruit, milk, eggs, nuts, pulses, high levels of phenylalanine. So pretty much if your diet has a lot of variety, you may have enough dopamine to deal with the pain. So next interesting topic, it worked. Yes, it did. Pain and mental health. According to the American Psychiatric Association, chronic pain and mental health are interconnected. People living with chronic pain are in heightened risk for mental health problems, including depression, anxiety, substance use disorder. Chronic pain can affect sleep, increase stress level, and contribute to depression. Anxiety, depression, other mood disorders occur at the same time with chronic pain conditions like fibromyalgia, back problem, migraines, arthritis, and according to Harvard researchers, more than 2/3 patients with irritable bowel syndrome, again, if you live your life, you probably develop this, have anxiety. Depression occurs in 35 to 45% of patients with chronic pain. I think I scared you enough. So no pain, no pain. Not only chronic pain is depressing. Shared anatomy, like it's not being in pain, it's just the areas in the brain and research in the brain are same. Pain and anxiety and depression. From the other hand, you probably know that like nice touch if you go to the doctor, mainstream, not a psychiatrist or psychologist, they will focus on pain, just direct complaint, what has to happen and what patient has to push and initiate this conversation and treatment of both problems. So from my standpoint, the recommendations are cognitive behavioral therapy. And if you talk to the doctor and they are reluctant, say, I will go to the support group. I need some cognitive behavioral therapy. You can do on your own relaxation training, hypnosis, exercise, and medications, antidepressants and anticonvulsants. They are researched and they show they can alleviate pain. But from the other hand, they also can have lots of side effects. So again, this has to be investigated with the primary healthcare provider to make sure you get what you need. Now we are all equipped to talk about gate control theory of pain. And I really feel for this guy, but again, artificial intelligence generated this picture, and I think, well, I feel for this guy. So what's going on here? Let's talk again. So nociceptor, as you remember, is just nerve ending which feels pain through the nerve, and this together is called afferent conducting nociceptor, sends signal to the spinal cord. In spinal cord, you have different types of nerve fibers. Those signals together, this is electricity, plus minus, go to dorsal horn, then to substantia gelatinosa, and then to the higher control areas of the brain. Simple as pie, right? This is even simpler. So the gate control theory of pain was introduced more than 40 years ago, and so far it just gained popularity. What's good about it, it allows to identify things which can be affected holistically. Sometimes it's something expected, sometimes it's something which is totally unexpected, but we want to find things which can be affected as opposed to masking the symptoms. Okay, so let me explain how it works. So if the gate, I think I have to press here. If the gate is open, then the signal goes to the brain and brain says you're in trouble. If the signal is minus here, it goes to the brain and the brain says everything good. So how it happened? The signals, noxious signals, go to the small diameters fibers in the spine. They go to substantia gelatinosa and they get to the dorsal horn, which decides, there is something excitatory for the brain, and I'm gonna send this so the brain screams. As opposed to when you have some sort of massage, nice touch, good meal, and then the excitatory signal is counteracted by inhibitory signal. So the sum total of those signals is calculated in dorsal horn. And then this signal is sent to the brain, and brain gives interpretation. Can I tolerate this pain, or this is unbearable? Questions about this? I just want to understand that you understand. I just want you understand that situation with pain can be handled by you. Like there is a mechanism which allows you under the same circumstances feel better. This is electric signal. So again, if you do this, you gently touch yourself. Like I injured here, right? So I gently touch. There are two signals going through the spine. So from here through the spine to the brain. One signal goes through the large nerve fiber in the brain. It ends up in dorsal horn, and there is a transmission cell which counts it. And that was, I hurt myself. That was, I touched myself. There is different polarity of the signal. If I do this, goes through different nervous fibers, which end up the same place in dorsal horn. So minus and plus, whatever is bigger, goes to the brain. And brain sends chemicals and whatnot all over the body for you to suffer or to endure pain or just feel normal. More questions? I can explain it one. Yes, please. Oh, oh, yes. Yeah, okay. Uh, Technology. Our brain is much better. It's very complex technology. Okay. Okay, so if you ask question, I can explain. No, those are neurotransmitters. Norepinephrine or epinephrine, serotonin, and dopamine. Yes. No, no, no. It works only for himself, right? So the optimal level of dopamine allows you to feel normal. Too much of this guy or too low of this guy, you will be primed for acute pain to go to chronic condition. Um, eh, it should be stable, and here the diet jumps in, not so much with serotonin and epinephrine, but with dopamine you can regulate the balance with the diet. It's interesting. Norepinephrine is usually painkiller. So have you seen any sports match on TV? Have you ever seen the guy injured, and instead of, like, if he can move, instead of doing nothing, he all of a sudden starts working better because he had epinephrine jump in his blood, and that allows for his performance to increase, but also it has pain killing effect. It's always with serotonin, it can increase pain, it can decrease pain, depends on the situation. Yes, so you don't need prevalence of one over another. You need a balance. And I will talk about it. Good question. Thank you so much. Uh, yes. Oh, sorry. Sorry, please. Yeah. Yes. Yes. Vitamin D is overrated. You will not have pain with vitamin D without. Yeah. Yes. Yes. But another thing about vitamins, you have to have all essential vitamins sufficient and in balance in your body. And the same problem with dopamine and vitamins. Too low, no good. Too much, no good. You can have pain in both cases. Yes. Mm-hmm. Right. Um, my understanding, I'm not osteopath or chiropractor or something in this modality. Nerve endings in the spine can be pinched by the disc, and then there is pain. If it's not a line, it's even more probability for the pain to arise without any injury. So the more you go like this, for some reason, my husband complains about his pain and he walks like this. I'm like, straighten up, straightens up, the pain is gone. Straighten up, gone. So the nerve endings can be just pinched. And when you go to a neurologist, he's gonna check two things. He's gonna check nerve endings pinched between the disc, and he's gonna check for the nerve conductivity, which means the signal which goes from the, say, finger to the spine can be exaggerated by the nerve or can be too low. You're so welcome. Okay. So, yes, this we have seen. And next, no. Yes, we were talking about making a break here, and I'm afraid I was talking for too long. I don't know. Do we have this luxury of making a break? Okay, let's continue. Thank you. Okay, because meat and potatoes come right now. How to close pain gate? Yes. Um. So here is the gate. The pain is behind. Several factors can open large fibers, which are stress, insomnia, tension, mental factors, and lack of activity. And several factors send signal through the small fibers, which are activity as opposed to medication, supplements, massage, nutrition, relaxation, being happy, cognitive behavioral therapy, and meditation. Um, if we are interrupted today, I will not be able to go far into this. So the book is Fibrofix by Dr. David Brady. Um, if you're interested in the subject, take it to the library, find it on Amazon. I got my own copy with his um, from Dr. David Brady. It will explain you many things things, and not only about fibromyalgia, but about your emotional balance, about exercise. Okay, the most important thing which you have to avoid being in chronic pain is stress. Um, the suggestion is very simple. Reduce social and occupational stressors. Go to cognitive behavioral therapy. Again, if you can pay $240 for an hour with a psychologist, good for you. If you don't want to do this, ask your doctor for referral to a group. You will be sitting with people and they will teach you how to adjust your behavior to deal with pain. Meditation, yoga, progressive muscle relaxation, all those things good to send a signal through small fibers, but the most important is moderate activity, but not over exercise. If that's possible, let's stand up and do couple stretches. No, no, no. This is very simple. Some people cannot tolerate massage because they don't want somebody to touch their bodies. There are areas on my body I will not allow to touch to anyone. So painful it is. From the other hand, if you use very simple self-massage with a foam roller, which you need mat, foam roller, ball, and rubber band, your expense will be about $30, give or take. The effect is tremendous. You can make pictures on, again, we will be able to send this. Shana, it's thinking and thinking. The next slide probably is the most interesting. It's about supplements. So while we are waiting for technology to behave, um, okay, it's not my day. Um, sure, sure. Absolutely, absolutely. Because magnesium can be absorbed through the skin. Hmm? Hmm?
Okay, the questions I have. Okay, obviously the first one is, can magnesium gel help?
Yes. Yes, because it absorbs through the skin.
And the other one is somebody saying kidney stones. I'm not sure what they mean.
Kidney stones is a very painful condition. Um, to reduce probability of pain, you have to know what materials the kidney stones are made of, say the 90% as oxalate base, and avoid foods with high content of oxalates. And those are good foods: spinach, almonds, beans. Sorry. Um, if you trying to be vegetarian, you're probably out of luck with kidney stones. So even don't try. Um, at the same time, there are some misconceptions about kidney stones, such as vitamin C provokes kidney stones. No, but if you take vitamin C, you have to take lots of water and you have to consume dairy products. Like if you eat dairy plus you take vitamin C, it will not support formation of oxalate-based kidney stones. Um, yes and no. There are opinions you have no calcium, but if you have no calcium, your bones become brittle. There are opinions if you take calcium, which is in normal dairy products, plus vitamin C, in this combination, you absorb and you don't form the stones.
The other one is a comment. It says traditional anti-inflammatories are ginger and turmeric.
Yes, I was going to talk about it.
Okay, because the other one even talks about our achar. Has fresh ginger, fresh turmeric, lemon peels, and they seem to work wonders.
Yes, yes, totally. Yes, my drug of choice if I play sports, if there is an injury, I cannot eat that much turmeric. So patch it around your injured spot, it's gone in a day.
And the other question is, how does the brain distinguish between the positive and negative responses?
Brain already is fed a signal. Huh? Okay. We will repeat. So brain already fed by dorsal horn the output plus minus. It calculated the output and output sent to the brain. So brain processes the information and shapes your reactions.
I'll give you the next question if you can repeat it so people on Zoom
Okay,
can hear.
okay.
If we have back pain, would that lead to Parkinson's disease, or is it the start of the fibromyalgia disease?
Okay, fibromyalgia is when you have pain all around the body. And you can, like, you know that the pain is in spine, it's not fibromyalgia. Then I would be getting Nobel Prize if I said what leads to the Parkinson, because nobody knows what starts Parkinson, unfortunately. Comes and goes, and it is accompanied by depression, insomnia. And sometimes the pain will be different in different places all over the body. It's not localized. Yes, please. Autoimmune disease, I believe, will be next week. But what's autoimmune? You probably meant rheumatoid arthritis, right? With rheumatoid arthritis, there is a high amount of pain. And we were talking before the lecture. Um, what I will say, don't tell to your doctor because you will have the same reaction. I am in stable remission for the last 20 years after starting weight-bearing exercises. She was sitting in front of me. I never heard that rheumatoid arthritis is so well affected by weight-bearing. Weight-bearing exercises. The pain I was tremendous. I wasn't able to walk. My feet were like this all the time. You're welcome. What? Weight-bearing exercises. Um, I have a theory. It's not patented, it's not research, but I have a theory that mild shock on your body, there is a mild stress and there is strong and prolonged stress. Mild stress on the body, which was weight bearing. It's mild stress. It's the little bit tears in your muscles. It's a little bit process with your bones, stabilizes your immune system. Little bit of stress, positive stress as opposed to long and like if you want to train to be on the scene with those bodybuilders, it probably will do no good. But mild. There is a thing sold in Canadian Tire for $129, and it's called TRX. Everybody has a place to live and the door to close. It just hangs on the door, and with this little thing, you can perform whole range of weight-bearing exercises for whole body. TRX. Yes, please. Yes. Yes, maybe. Does it hurt? There's no pain. Um, it's difficult to say, like again, this is, I would need several sessions to understand what's going on with you and how I can. Is it Parkinson? You don't think, how about the doctor? Ask, listen, you pay the taxes, right? So you're entitled to ask questions. And if this doctor doesn't answer, go to the next one and say, my nutritionist told you. Yeah, no, yeah, yes. There are some situations when your muscles just feel weak. There are 1,000 problems which can lead to this. As a nutritionist, I would say eat balanced diet and play tennis and do weight bearing exercises. Yes, please. Right, right. Same here. I fry my hand. Yes. Okay. There is a thing which is called athletic tape. So if you know that you have to do something for quite a while, just, I don't know if you see the difference in color here. So like put athletic tape around your wrists and it doesn't go limp. With athletic tape on the wrist. Like this, right? But with T-Rex, it's even easier because you can, like, you, how you regulate the weight, you can go far, you can come closer, and you select the weight exactly what you can bear versus whatever's given you in the. Yes, and another thing, okay, sorry, it's a little bit like this. So with, with the wrist, do 100 of those, then 100 of those, and 100 of those, then turn your wrist and try this. This is physiotherapy. Again, if physiotherapist hears that he's gonna kill me because I take his bread, but this is free and do 100 of those a day and see if it works.
Next question I have is, have you heard of nerve?
Mm-mm. Mm-mm. Okay.
Nerve.
Narviv. I don't know what it is. So no, no. Shana, can I please have next slide? Maybe some questions will be. Sure. Okay. Yeah. First of all, your wrist has to be totally comfortable. I think this position is the best. So hold it like this. I don't know, like this 100 times. And turn it. Do like this. Then in this direction, again, hold it like this 100 times. And turn it and hold it and do it like this again. What it does, it releases the nerve and builds the muscle. And that pretty much what can cause the pain in the wrist. Okay. I don't need to dance ballet, right? Yes, totally. Okay. Okay. Like this. By feeling. don't overdo it. You can injure yourself. Flip the wrist, hold it. Flip the wrist on this side. Flip the wrist on this side. It's the most difficult, but the most rewarding. No, 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 no. Up and down, up and down, up and down, up and down. It hurts. Up and down, up and down. Like this. Welcome. Can we please talk about supplements? Because I'm dietary supplement professional. Okay. Um, we have topic of supplements and topic of how to reshape your nutrition. And I think I will go through your questions rather than. Okay, next slide, please. Okay, that's a big diagram. What I was trying to say here, and probably like if you ask for the presentation, you will get it. Those are tasks you need to address holistically. We are addressing them holistically to get rid of pain. This is all metabolic processes you try to control. So mostly those processes create more serotonin and reduce pain. So instead of masking the symptoms, which I also can suggest not from over the counter, but with some supplements, instead of doing this, try to utilize processes in our body. And task number one is boost serotonin because, well, you can do it, right? So antidepressants. What antidepressants do, they prohibit your cells to absorb the serotonin, right? So there is more serotonin circulating in your blood, and there is higher probability for serotonin to go to your brain. Which idea is good? I'm not saying this doesn't work. Many people have adverse reaction. One of the reasons is your cells need serotonin as well, right? So if it's free flowing, that means your cells are void of serotonin, and well, I'm not going there. The alternative way is just try to take precursors for serotonin and hope that your body can convert. And one of the good things is 5-HTP, 5-hydroxytryptophan in dose of 5,100 milligrams. Take it with meal and see how your body reacts. Does it affect your pain or it does not affect your pain? 5-HTP, just a second. I'll show you here. 5-HTP. Oh, nope. Nope. Here. One word of caution. If you're already taking SSRIs, talk with a doctor. Because taking 5-HTP or St. John wort can increase serotonin to the levels when you will experience serotonin overload. This is diarrhea, vomiting, spasms, rigidity, all unpleasant things. So if you plan to do this, talk to your doctor, say, I want to take a supplement. How much can I take? And how much SSRI should I take? That's it. Another thing, take 5-HTP with vitamin B6 if you decide to do so. And in terms of precursors to support your mood, actually it's accepted by psychiatrists now here. Some E is a precursor for dopamine, norepinephrine, and serotonin. And in the dose of 400 to 1600 milligrams per day, which is totally safe, it stabilizes your mood and relieves chronic pain. Questions about those two guys? Have you ever heard of them? Okay, good. Okay. Magnesium. You need to calm down because being calm closes the pain gate. You want to send signals through S fibers, and those signals are being calm. It's magnesium, calcium, phosphatidylserine, and phosphatidylcholine. L-theanine in green tea I have here. Green tea makes you not only calmer because it creates more GABA calming neurotransmitter. It also helps you to concentrate. And like I was driving back 50 kilometers because I thought I left something turned on, and I did. So I drove 50 kilometers back, turned it off, and drove back instead of just taking green tea, right? So, uh, um, I also, I don't know if you heard of those Tulsi and ashwagandha teas. Instead of gulping coffee, I would suggest Tulsi tea, which also has calming effect and positively affects your pain. Another thing is guilty as charged. Can I see hands who sleeps 8 hours at night? I want to be a friend. um, if you don't sleep well, you open the pain gate, right? So you need to take something which supports your sleep. And melatonin is actually a very interesting thing. Talk to your doctor how much, but 9 milligrams before going to bed should be enough. Serotonin is precursor to melatonin. But if you don't have enough melatonin in your brain, the amount of serotonin in your brain reduces. So if there is enough melatonin, it acts in synergy, increasing serotonin in the brain. You feel happier. Where is my pain? There is no pain. Huh? Caffeine, yes, but L-theanine. Not before going to bed. Not before going to bed. Another thing, symptomatic. I want to show you this. Have you heard about this compound? It's wildly researched now. It's a palmito ethanolamide. Palmitoethanolamide. What it does, I'm not sure in this setting I'm allowed to say, but it acts through endocannabinoid receptors. Endocannabinoid receptors regulate balance of neurotransmitters in your brain. So this guy is a natural painkiller. Everybody has it in their brains, like people, animal, mice. But if you don't have enough, there is higher probability for you to experience pain. But just natural painkiller. You can take it forever. It doesn't have any side effects, and it works. PEA, palmitoethanolamide. Fish oil. Yes, fish oil. Fish oil and fish. Okay. You have to take at least 1,000 milligrams of EPNDHA daily to act on your pain. But there is a dilemma here. If you take a pill, it's a pill, and the pill may go against your blood thinners. So again, if you take a pill, discuss with your doctor, but you may take fish and then you may have this naturally. So some people, when they go vegetarian, they say, we are not taking fish oil, we're gonna take flaxseed oil. Good, good for you if you have diabetes, because flaxseed oil reduces free-flowing glucose, but metabolic speed rate of conversion of ILA to EPA DHA is very low. Like it's from 1 to tops, you have to be like perfect metabolizer, 10%, which means to have 1 gram of EPA, you need to drink 100 grams of flaxseed oil, which is physically impossible, right? So either from supplements or from fish. Now, we all like fish to be like with this crust, right? Spices on top and crust and tasty. If you cook fish more than 2-3 minutes, you would reduce EPA DHA content for about 90%. So forget about fish, right? What you can do though, does anybody use instant pot? Yes, instant pot. Yes, good. So you steam it for 1 minute. It's not high temperature, high pressure. So everything this fish has to offer will be still in your piece of fish and you can eat it. So that's my only suggestion, how you can use instant pot to get rid of your pain. How about that? Palmito ethanol amide. I cannot say it's one word. I cannot say PA. So this is something we have in our brain and all animal brain as well. It has calming, not so much, and pain-killing properties. So one of the reasons you may have pain too much is you have low PA in your brain. You take the pill, you take supplement. PA. Yeah, and tell I want PA, then offer you options. It's good if you have kidney stones, but other than that, not in this context. No, no, it's good. It's good for you. It's natural food. Yeah, yeah. No, no, no. It's palmetto ethanol amide. This is peptide. Uh, Animals. It's not vegetarian. It's animal. Health store. Any health store will. I Yeah. What else? For the Yes, yes. And I don't know how to increase it. Yes, yes. Another thing is if people have diabetes and diabetic neuropathy, um, in this case, diabetic neuropathy is positively affected by N-acetylcysteine or NAC. This is very powerful antioxidant, but very expensive though. It's very expensive, but very powerful. And coenzyme Q10. The doctor would recommend you to take coenzyme Q10 for your cardiovascular health, which is great. But as we age, Coenzyme Q10 acts well in neuropathic pain, and if your gallbladder is removed, you have to take it every day because bile salts produce Q10 naturally. As you lose your gallbladder, you lose your Q10. Yes, please. Yes. Yes. Say again. Yes. You are poster guy. Yes. Yes. For cardiovascular. Yes. Especially diabetic pain. He takes it for cardiovascular. Q10 taken for cardiovascular, of course, good for diabetic neuropathy. Okay, as a member of association, I am supposed to say you have to take your cholesterol medication, full stop. But as holistic nutritionist, I would say you have to take it with Q10. Yes, please. Okay, if you have your gallbladder removed, you probably need daily portion of ox bile, Q10, and NIC. Yes. And probiotics. Yes. Yeah. And you're still alive. Good for you. Okay, so probably your marriage is very successful and and your wife is good cook. Because supplements are that by the name, they are supplements. They're supposed to supplement what you eat, not replace what you eat. Nobody wants to cook. Everybody buys those processed. Okay, processed food, processed food, processed food. If you take processed food, you don't take any nutrients. They're fried. There is colorant, E110 or whatever, added. There is oil from animals which do not exist. Like, if you buy this food in beautiful boxes, you have no nutrients. You need a wife to cook. Huh? Yeah, right. Yeah? Yeah, right. Yeah, sure, please. That's very right question. Okay, there are supplements, minerals, vitamins which can be dissolved in the fat, in the oil. Some are water soluble, like vitamin B and vitamin C. So vitamin B, vitamin C taken before the meal at least 30 minutes, but not together, because supplementing at the same time reduces bioavailability, like vitamin C and vitamin B both. Pretty much the rest, it's better to take after the meal. If you take NIC and you're hungry, your stomach will be churning, your eyes will pop up. Okay, with my license, I only allowed to tell you take recommended daily intake or what's on the bottle. Like if bottle says you have to take 3 of those, take 3 of those. Because especially if you buy them in Canada, because the industry in Canada is very much, very regulated. I was part of preparation of documentation for one single supplement. They have to submit about 500 pages to Health Canada. So the safest is to buy from Canadian retailers. in health food store or whatnot, not on Amazon or shady sites, and take what's on the bottle. PA, PA, yeah, yes. And since we started talking about how to take supplements, um, I cannot stress more importance of drinking water. So when you have pain, your body is on alert. There are blood cells like phagocytes, neutrophils, you name it, which roam around and collect bad stuff and kill bacteria. Then those bacteria go around in your blood. Then you scrape yourself. Where those remnants go, they go in your blood. So you need to eliminate this through skin, through lungs, through whatever. You need at least 12 cups of water a day. Pop, coffee do not count. Just water. Yes. Um, okay, that's another question, and that's a very, very good question. So, your kidneys have a mechanism to remove salt and electrolytes. So, if you drink a lot of water, your pee will be almost transparent. Whereas if you don't drink, it will be dark because kidneys regulate. If you still have half functioning kidneys, they will regulate how much. But what I do, again, you can do this, I add a little bit of Himalayan salt in my water, like a little bit. Yes, please. Why would you need it? Okay, fluoride. Fluoride. Okay, so about water. First of all, when you use tap water, at least you know that Canadian government controls what in this water. Then if you add filter, osmosis filter or Brita filter or whatever filter, you will more remove chlorine and leave good drinking water. When you buy bottled water, you don't know who bottled this, where it was bottled, when it was bottled, and what leached from the bottle into this water. So from my standpoint, is just a risk for your health and waste of money. Did I answer your question? Sure, thank you. Try not to. Huh? Tap water plus filter, because like the standards in Canada, other westernized countries are very high. Um, the problem with it that there is a threshold for whatever chlorine, medications, hormones in this water. Now, the water is recycled here, right? Whatever we eat, pee, poop goes cleaned and goes back to the lake and goes on your table. That's why I would say adding a little bit of filtering to this chain won't hurt. Yeah, tap water. Huh? If you boil it, you will not remove chlorine, medications, and whatnot. Yes, please. Uh, Just sorry. Uh, um, okay. With this problem, there is a department in Western Hospital. I would suggest go right away. for the, they take people who have problems after cataract removal. You like go there and explain your problem. Try to get like through emergency. And there is a department in Western Hospital which deals with post-cataract removal complications. Western Hospital, Butter Street, Butters and College. Yeah, Toronto Western. He has problems after removal of cataract. And it may be, I don't know what it is, but those guys deal with those problems. Yes, please. Yes, you should. Uh, can you have fish oil with kidney stones? Yes. Yes. China. Okay, so my personal affinity is for the products which are the less processed, right? You don't know which chemicals were used to remove the caffeine. This is my personal. I don't know any research about this specific tea. Huh? I don't know about this supplement. Seratoline. I don't know. Is sertraline okay for anxiety? I don't know sertraline. Sertraline. I have tingling in the feet and fingers, but I don't have diabetes, and my EMG test electromagnetic was better than normal. Any advice? Uh, this is a murky road. I think trying vitamin B12 and C, it makes difference. If it does not, go back to neurologist and explain situation, and go back until they have an answer. Huh? Yes, it's one of the symptoms of the deficiency. No. Vitamin C is water soluble, vitamin D is fat soluble. So you have to take vitamin C 30 minutes before the meal. Vitamin D goes with the meal or after the meal. Yes. Magnesium you can take up to 500 milligrams or even more if your body tolerates, divided by 3 intakes after the meals. If it makes you sleepy and relaxed just before the bed. Oh, I have another slide, but we don't have time. The next one is, yes, yes. Yes, please. Yes, yes. Okay, as a specialist or as a person? As a specialist, I have to say, talk to the doctor. But when my doctor discussed it with me, I said no. Because it affects your immunity, right? I already had immunosuppressant therapy, and I was left without immune system. So you want more? I don't. Like, but this is my personal, maybe your situation is different. If you never tried it, you may be okay. PEA and water, 12 cups a day. Okay, so let's look at it. Questions. Questions about, does everybody knows why you don't eat, why you prefer organic produce and food over conventional. Yes, say again. Yes, what else? I heard pesticides. Hmm? Pesticides. What else? Hormones. Hormones. Yes. What else? Yes. What else? Yes. What else? Huh? Yes. What else? Uh, yes. Or two more things at least. Irradiation. Your spices, if you don't buy halal or kosher or organic, are irradiated. Um, Nobody knows how it will affect us humans, but there are some negative effects on in animal studies. So there is experiment on humans now. It's one thing. And another thing, organic foods have sometimes clear benefit over conventional. If you get organic grass-fed butter, it has both omega-3 and omega-6. Whereas if you save $2 and you buy regular, you have overload with inflammatory omega-6. Sorry, okay. Yes. So actually, organic is very tough to receive. It's not just label. You buy in the store and they say organic, they went through so many gates to get it. Sometimes, if you buy it in farmer's market, just talk to the producer. He would say, well, we sprayed a little bit, but if it's small producer, chances are it's not GMO. He doesn't use glyphosate because it's outrageously expensive, and it will be clean enough, right? So it's vice versa. When you can go to the farmer's market and get conventional, be happy about it. Oh, that's a big deal. Um, if it's not organic grass-fed, human meat and butter, right? It has only omega-6. Omega-6 and inflammation. Inflammation is your brain malfunctioning, you have pain, you have autoimmune, you have like whole bunch of crap, right? Whereas if you splurge for $2 more and buy at least grass-fed butter, it will contain omega-3. So the same food, the same taste, but it's anti-inflammatory versus being inflammatory. That's what I'm saying. Your wife knows how to cook. Um, good thing. So eggs. From my standpoint, we don't eat eggs correctly. The best thing in eggs is eggshell with a little bit of membrane, because for those of us who are well, live their lives, we have osteoarthritis. Probably 99% of people here, you're losing cartilage. Eating this membrane on the salad or whatever restores your cartilage, right? No, no, not eggshell, like the membrane. So there is a shell, like it's almost impossible when you boil the egg to consume this. So like remove it, bake it, grind it, and put on your salad. And here is your osteoarthritis medication. You're welcome. Uh, 1 to a week will be good. Sorry, will be good for you. It will not hurt you. But the eggshell membrane is the most important thing in your diet. Yes, and high in cholesterol. And if you take medications and then you eat eggs, you know what? This is counterintuitive. It's okay. Yeah, but even if you do this, you will not release membrane. I would say break the egg, get rid of the whatever inside and eat the shell, but yes. No, it does not, but it becomes very difficult to remove this eggshell membrane. It's difficult, just physically difficult. Yes, when you boil it. Like, no. Canola oil has high um, burning point, which is good, but it is usually produced with glyphosate, GMO, and whatnot. And just from anti-inflammatory standpoint, it's better to avoid. I use avocado for high temperature and olive Yes, dairy is highly inflammatory. Only 5 kilos of spinach. No, almonds. Almonds is good. So what I'm doing, okay, so I'm making amaretti for myself. Amaretti cookies. So you buy almond flour, mix it with apple puree, add some sugar, some spices, whatever you want, and make cookies and bake them. It's nice and tasty, and it's almond, and your teeth do not suffer. Yes, absolutely. According to Health Canada Food Guide, even if you have lactose intolerance, glass of milk your body should tolerate. According to Canada Food Guide, even if you have lactose intolerance, you should be able to tolerate at least 1 glass of milk a day. Yes. But dairy is inflammatory, so you have to weigh pretty much how inflammation affects you versus how desperately you want this calcium. You can replace it with almonds, 5 kilos of spinach, or supplement from the bottle. Questions? Yes, please. Um, Clarified butter doesn't have lactose. That's all I know. And it was recommended, like when I was in school, it was recommended as a healthy alternative. Yes. Oh, no, 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 no. Artificial sweeteners, um, they, they are the hugest disruptors of the signals in your brain. People given with multiple sclerosis who are given artificial sweeteners have exacerbation of their symptoms. So if you don't want your brain to suffer, you'd better stay away. Tea is wonderful without sugar. Tea, like tea. You can drink tea, coffee, whatever without sugar. Yes. For Alzheimer people, you know, good fats are better than coconut oil. And good fat is omega, right? So it's anti-inflammatory, but it has a little bit too much of saturated fat in it. Huh? Cheese is dairy. Cheese is very, cheese has three properties. It's very tasty, it's very addictive, and it's dairy. Addictive, and it's inflammatory. Say again? Oh, okay. Thank you so much for the question. And I think this milk is fortified, so vegetable milks, oat milk, almond milk, soy milk are fortified with calcium. So if you want to put, like you want the taste, or you want it in a recipe, that's a very good alternative. Yes, yes. Do you put some calcium in it? Yes. It's tasty, but you need to put some calcium. Oh. Can you please come over? I cannot hear you. Me, yes. Uh, from the Okay, what's in this bottle, I don't know. It's highly processed, it's very chemical. So if you know that, or you feel, or your doctor told you you're deficient on some things which are on the bottle, take it. Yes, so see what's in it. But I don't know, like, we are not 18. Who is 18? Raise a hand, right? Okay, okay, okay. You so well.
Thank you, Larissa. It shows we have so many questions. Do you mind staying around if they can come? Yeah. So if you don't mind, Larissa will be around. You can come and ask her questions and she'll talk to you guys, okay? Thank you. I'll ask our chair Fiaz Mukhi to come and talk and wrap up the sessions. And then we have lunch. Yes.
Thank you. Thank you. Thank you, Larissa. Excellent, excellent presentation. I could understand you more now that you're in person compared to when you did it on Zoom. I can understand more, and I can see there are a lot of burning questions from everybody. It's regarding all the holistic approaches that you have, because pain, everybody has pain. I had pain this morning, but I took a supplement of Tylenol. So now I learned that there are other supplements which are better. So I'll start looking into that as well. So I also want to thank Ismat for the wonderful organization in you and your team. I would want to thank Shamsha. Where are you? Oh, yeah, like you can see, they cannot. I'd like to thank Shamsha for doing this seva for the longest time. For so many years, she's been doing this seva. But seva is in her heart. So I'm not going to leave this seva. I'm going to take another portfolio and be there in the team so I can be with the seniors. So now in your heart, make it seniors. Thank you very much, Shamsha. Really, really appreciate you staying on and you can help. We can see that seniors have always been in your heart. So thank you. Thank you, Ismat, once again. Gyros and wait, oh, okay. I can see a lot of ladies at the back with white hairs. So it's all the hairness that you're wearing, right? And thank you all for coming and making this presentation. We have part two of this presentation next week at Willowdale. Anybody interested in going to Niagara Falls? Willowdale has some tickets. Don Mills has some tickets as well. So you can purchase those tickets. But only thing is you'll have to go there. The coach will want to be coming here. It'll be a good trip. It's going with the coach and मजा आती ताकि आवे हूँ न तो बड़ा मजा आती. Thank you, Ismat. So we all ready for lunch? So this is what I don't like about Ismat. He puts me in between the lunch and. But thank you, Ismat. So we can all go for lunch, and Larissa is here. If you have a one-to-one question, she can answer all your questions. But it was very, very well received today. Thank you, Larissa.
Thank you so much. Thanks for coming.